Hey, welcome to my channel. This is the theboggusdoc and this is the first video of this group. Okay, so there was a question in previous year exam that what uh, post-inferior cerebral infarct, what does it cause? Okay, it causes lateral medullary syndrome. You have to remember it by heart anyhow. Okay, there are some things that you have to remember now here, that this is the circle of Willis and its blood supply. You have to remember it by heart. Okay, first thing, the vertebral artery. The vertebral artery is a branch of subclavian artery, right vertebral artery, right, left only left subclavian artery branch. Okay, I hope you remember the arch of aorta. This is arch of aorta, and if you go, this is the brachiocephalic trunk. Okay, the brachiocephalic trunk is divided into two parts. This is the right common carotid, and this is the right subclavian. Okay, then this is the left common carotid, and this part is the left subclavian artery. There are multiple of questions from this. The left common carotid artery is a branch of, right common carotid is a branch of. There are hundreds of possibility. Okay, the thing about this, after the two vertebral artery, these two vertebral arteries then met and make one single basilar artery, and this basilar artery divide into bifurcate into two branch. Which branch? It is the posterior cerebral artery. Okay, this is important. Here, on the another part of the game, there are internal carotid artery. The internal carotid artery is divided into two parts. Okay, one part is the anterior cerebral artery, middle cerebral artery. Okay, and this is the posterior communicating artery. The question can be there that what posterior cerebral artery is a branch of. Posterior cerebral artery is a branch of basilar artery. You can think of like this. Okay, after this, there are anterior communicating artery that are join the anterior cerebral artery both. The important part is you can add that anterior choroidal artery is a branch of internal carotid artery, and ophthalmic artery is also branch of internal carotid artery. You have to remember it by heart. Okay. The thing is, there are two main things, that pica is a branch of vertebral artery, and the infarction of pica cause lateral medullary syndrome, and the infarction of anterior spinal artery cause the medial medullary syndrome. Okay, there are two other part, anterior inferior cerebellar and superior cerebellar arteries also there. Okay, after that, you have to remember what pica Pikachu you can remember by this trick. It is the W is the last letter. You can remember Wallenberg syndrome by Pikachu, and it is a dysphasia is the differentiating feature. Pikachu pica means dysphasia is the differentiating feature when there are lateral medullary syndrome and medial medullary syndrome, or you are something you are forgetting something. Okay. I think you know the rule of 4 now. That is valid for brainstem stroke, or the things which are divided, the things mean the number which are divided by 12 or multiple of 12 is medially located. It is therefore only for brainstem stroke, means stroke of midbrain, pons and medulla. The things, the numbers which are divided by 12 or multiple of 12, like 3 is multiple of 12, 4 is multiple of 12, 6 is multiple of 12, 12 is multiple of 12, are located centrally, means in the infarction of central part of the brain. These are the now that will be gone. There are four of the structures that are in the midline: medial longitudinal fasciculus, motor tract of upper motor neuron, medial lemniscus, and motor nuclei of cranial, motor nuclei of canina. These are the midline structure, and the laterally located structure are spinothalamic tract, spinocerebellar tract, sympathetic chain, and sensory cranial nuclei. Up, just imagine the examiner will give you lateral medullary syndrome. The lateral medullary syndrome, you have to remember the lateral part which will get affected. You know that the in lateral part, what are things that will be affected? 5, fifth nerve, okay. 6 nerve, okay. 7 nerve, 8 nerve, 6, not 6, 5, 7, 8, 5, 7, 8, 9, 10, 11. These 9, 10, 11 nerve, and these are laterally located things. Spinocerebellar tract is involved. That's why there is gait ataxia. Sympathetic chain is involved. There will be Horner syndrome. There is pain and temperature contralatery due to spinothalamic tract involvement. Okay, and the important thing, hemiplasia, it not seen. So I think you will remember the important part of this. Always remember what makes the circle of Willis. It is the anterior cerebral artery here. Anterior communicating artery can be answer, but this is the important. This is important, and this is the posterior communicating artery. I hope this will help you.